Hello, can you hear me? Good evening, everyone.
Good evening.
Yeah, good
Yeah,
evening.
Good evening.
Yeah, what's it?
Good evening.
yeah. So this is to welcome
Good
you all to the
evening.
seminar session for today, for this webinar. So I'm thanking you all for joining us for today's webinar. And our guest speaker is Dr. Sina. It's going to be impactful to this session for us all. So please, I will want you all to listen very well and learn with this webinar. So I will leave the floor for Dr. Shino now to go ahead.
Okay, all right. Good evening, everyone. Am I very audible?
Yes,
Very
you're
loud
very
and clear.
audible.
Okay, and thank you so much for this initiative. A shout out to the mobile classroom team for and my class team for putting this together. It's not really easy, and I think this is a very very important and I think a very funny topic. We're going to be talking about sexual wellness. We're going to be talking about STDs, and I'm sure a lot of people are going to have questions. So if you know young people that you know that at that age of being sexually active, I feel a lot of people are going to benefit from this. So you can also, share the link. I'm sure more people will join us as we go on. So I'm just going to start it right now. Well, I think you can be moving the slide. So I'm using another laptop again. So, well, I don't know the first slide. I'm not seeing it again. But we'll basically we talk about. I don't know if everyone can see the slide. It's being projected because I cannot see it. Is a slide being projected? Hello.
Hello, can you confirm if you can see the slides?
I cannot
Yes,
see the
I.
slide, but I don't know if. Okay, can the people see the slides?
Yes, I can see it.
Okay, so okay, good. I cannot see it. Maybe because my video is up. So I'll just say next slide so you can just show all the talk. So the first slide
Okay.
is what exactly is health? A lot of time when we talk about health, people just think health is when you don't have diseases. So that's not true. So standardly, any doctor will tell you health means it's basically has to do with a good state, both psychologically, physically, emotionally. So it's not just you not having that diseases, you understand. So it's actually bigger than that. And if you look at the next slide, I put there what exactly is reproductive health. And my definition there is a complete physical, mental, and social well-being, and one that also that has to do with reproduction. So everything that has to do with reproduction. Good, 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 good. That is reproductive health. So I think this diagram is important. I don't know if we all can see it, and it shows the male reproductive system. I think it's very good we know this because a lot of our conversations are going to him on this. So if we understand how the male sexual reproductive system goes, we are going to understand why is it that when somebody has gonorrhea, why does it happen here? Okay, so well, I'm not sure if I could use the cursor, but if you look at that diagram, it's just like a side cut of what a man's sexual system looks like. You can see the penis there, and the circle which is called balls. You can see it. You can see it now. It's very important organ because I was talking about it. If you just look at, you can see that orange thing, that thing called orange called prostate. It's very, very important. I'm still going to touch on that also. Well, you can also see the anus of the man. So I assume that, everyone can see this. Now, the next one is the female reproductive system. So this is also important. So we're going to touch on this too. And some things I want you to focus on. I don't know if we all can see it. One, ovaries, what we popularly will call eggs, and uterus, that thing that looks like a cup shaped, what we call womb, uterus for sure. You can see the vagina just down there. If you can just look down there, and then you can see this thing called cervix. Cervix is like the gate of the womb. When they are saying I want to shift your womb, a lot of time it's the cervix they are touching. We'll talk about all of that again. Okay, the next slide. So the first thing that I thought we should open with is STDs. And why did I think about STDs? I'm sure all of you use social media. There was a video that was viral, I think like 2 days ago, that showed someone's penis and he had this funny growth on the penis. Everybody was like, "What the hell is this on this man's penis?" I'm still going to touch on that shortly. But just to give you some figures, over more than 1 million people actually have STDs, and every day people contract STDs. And the commonest age of people that have STDs is actually between ages 15 to 49. And the thing about STDs is that a lot of them asymptomatic, so it does not even show. Nobody sees anything. Just to say more, so in 2020, I put here there are about 374 million people with diseases like chlamydia, gonorrhea, syphilis, and trichomoniasis. Those are like common STDs people have. And about in 2022, we had about 8 million people between 15 and 49 had syphilis. Okay, now let's talk about syphilis. Syphilis is a very common one, but a lot of people don't even know what exactly is syphilis. So let's start with syphilis. And no, syphilis is caused by bacteria and popularly spread by any form of sex. When I say any form of sex, means whether oral, anal, vaginal, any form of sex. So doing blowjobs, all of that can spread syphilis. And like I mentioned earlier, many of these don't show signs sometimes because they are a lot of time they are neglected. And one thing about syphilis is that syphilis, if it's not well treated, can go from the mother to the child. And some signs when one has syphilis. Now, these are one thing. I'm not saying when one has syphilis, but these are some ways usually show. In men, the first thing you will know, the man will notice, they will notice is like a rash of pimple on the penis, and then some changes. I think that pictures. Okay, you can look at the next picture. I don't know if you can see the next picture. You can see that someone's penis. You can see this something like an ulcer, which we call chancre. It's usually is found in. If you look at the next slide now, look at this man. If you see this man, I'm sure if you look closely, I don't know. Can we see it?
Yes, we can.
Yes, you can see that man has some sort of ulcer. So good. And next slide again, if you see this man has something that looks like a rash on the skin. So still same with syphilis. Now next one, you can look at that hand. If you see that hand, um, you can see this. The man has something like some rashes on the hand. Yes, and so this is how syphilis presents. Now these are various manifestations of syphilis that people don't really popularly talk about. Okay, so syphilis, first one. Now the next one I'll just touch on is herpes. I think herpes is very, very popular. And what is popular about herpes is that a lot of times when people have herpes, they will say they're having malaria, or they will say, what's the name? Ishino. There's a Yoruba name they call it. I forgot it. But herpes is caused by its virus also. The virus is caused herpes. And one thing about herpes is herpes can be in saliva, in the semen, in the vaginal fluid, everything. And that's why I usually would say, if you follow me, you notice I'm pro, don't give people's babies, because you can never tell anyone who has herpes in the saliva. And it can affect your baby. And one thing about herpes is it can go anywhere. It can go to the brain, it can go to the spinal cord, it can go to the eyes, it can go anywhere. I've shared a video before on Twitter whereby a baby actually had brain damage from herpes. Somebody kissed the baby, the person had herpes, did not know the baby contracted herpes, and the baby later developed brain damage. Herpes. All right, next slide. Now that is now how does herpes show? Now, when one has herpes, one of the ways it commonly would show is you see this like rash on the skin, and well, this is a picture. I think I have one with the black. Oh, did I put on? I didn't put someone. Apologies, I should have put how it looks in a black person, so would have seen it well. But it looks like this. Usually, the next slide, you can yes, the mouth one, and I'm very particular about this one because you see this on people's mouth. They'll tell you they have malaria. It's not malaria. It's herpes. So I hope you do know that it's not malaria. It's herpes. In the next slide, you can still see that thing on the leaves. A lot of people do have something like this, and they tell you that I'm just no. So basically, what happens is that herpes, once one has herpes does not have a cure, and the herpes kind of hides in the body. And if you do anything that reduces your immune system, then the person has what we call a flare. So, and the herpes then comes out, and they have eruptions. So technically, there's no cure for herpes. Yeah, there are treatments to prevent it, people breaking out. You understand? That's one thing you need to know, and that's why if you ever have herpes, you need to talk to your doctor. Very, very important. Okay, the next one, the popular one which everybody talks about, gonorrhea, and I think gonorrhea is one of the popular ones because there's a lot of drugs. Everybody say, "Oh, I have drugs for gonorrhea." Do you have gonorrhea? Gonorrhea is also caused by bacteria, specific Neisseria gonorrhea, spread by sex to mother to child can also have it. Very important. I've noticed many of these diseases can move from the mother to child. And that's why sexual wellness is good for people to understand this, so that when you have gonorrhea, you need to get treated. Because if you don't get treated, apart from spreading it to your partners, it can actually go to the child. And commonly in men, when men have gonorrhea, one of the common things is they start having pain when they are peeing, they could have discharges, and also sometimes it affects the testicles because start itching them. It can also go from mother to child. So some pictures. Well, I hope it's not too graphic. You can see that picture of someone's penis. You can see that thing like milk coming out. That's gonorrhea. That's one of the things gonorrhea presents with. The person starts having this milky discharge. And next you can see the cervix. So that's a woman. The woman is also having discharge from the cervix also. Now another thing is, because a lot of this is 21st century, a lot of people have oral sex. So you can actually have gonorrhea occurring in the mouth. Now this is a picture of someone probably got blowjob from someone that was having gonorrhea and had gonorrhea of the throat. That's a very real picture. And well, this is another picture just showing gonorrhea in a woman. I know. Okay, good. Now, chlamydia. Chlamydia. Well, people don't really talk about chlamydia, but it's a big deal, especially in developed countries where there's a lot of sensitization done on that. And it's also another bacteria that's very common and also could present with discharge from the penis, vaginal pain, and it's very, very, very important in women. Why is it important in women? I'll come to that shortly. It can cause infertility, same with gonorrhea. So one of the common leading causes of infertility in women is something called PID, which I'll touch on later. And one of the big culprits are chlamydia and gonorrhea. And let's see, why does that happen? We're going to touch on that later. HIV, well, I won't say much about HIV. We all know about HIV, human deficiency virus, and it's spread by sexual intercourse, blood transfusion, IV drug abuse. So people that inject themselves and share needles, they can also have that, and it has tons and tons of manifestation, like a lot of tons of manifestation. Which well, HPV. Now, where I'm going somewhere. Now that video that was going viral, that person had what? I don't know. I could not put the video in the slide, but I'm sure we saw that video. I think it was trending like 2 days ago, and you see someone's penis like had this like bumpy, 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 bumpy. Now the person had warts, and of course it was HPV. But the good thing about something like HPV is that there is a vaccine, and that's why if you follow me, you notice that I always say that get your HPV vaccine, because a lot of people condoms don't even protect the HPV vaccine, because all you need to do is two people's skin doesn't touch each other for one to have HPV. And HPV can cause a lot of things. Apart from the what, some strains of HPV can cause things like cancer of the mouth, cancer of the vagina, anal cancer, and all of that. And that's why, like I always say, everyone should get their HPV vaccine. Okay, this is a picture of what? I don't know if you can see it. It's a picture of what you can see on the penis. You can see that thing that looks blacky. That's how what looks like. Another picture of someone's penis also, that the person has what. And next picture, this person has what of the nails. So anywhere the virus affects, the virus can grow there. That's the hand. Maybe the person was fingering someone who had HPV. I mean, you never can tell. Well, hepatitis B virus, a lot of things have been going on around hepatitis B virus too, because it's also been spread via blood. It also can be spread from mother to child, and also when you have contact with infected fluids. Like I said, all of these things, many of them don't show. And because a country like Nigeria, many people don't go for routine tests. Many people don't go for all of these testings because actually, have infection. And I usually like to tell people, we talk about HIV too much, but hepatitis B is 100 times more infectious than HIV. But everybody talks about HIV. Hepatitis B has a vaccine. HIV doesn't have a vaccine. Which means and the vaccine in hepatitis B can protect you almost 99.9%. So if you're listening on this cast, please to get your hepatitis B virus vaccine. And one of the things about hepatitis B is that hepatitis B, can damage the liver, can cause something called cirrhosis. If it's not treated, it can go to cause liver cancer. Nothing everybody, but in people that don't get the virus. So if you look at the next slide, that's this is how a normal liver is in Yoruba, how the normal liver should look like. If you see this next one, that's what a cirrhotic liver looks like. Now, this is just showing how it can change from hepatitis B affecting the liver and the liver changing into a cancer. So this is how it's just good. It looks like. Okay, these are not very, very common, but there are some diseases I felt since we're talking about sexual wellness and prevention, I felt we should talk about it. Something called trichomoniasis, donovanosis, they're not common, something called chancroid. Well, this is what trichomonias look like. When you say this, say something like, oh, I'm having green yellowish discharge. A lot of times it's trichomonas. You can see that picture. This is someone that's trichomonas infection and is also spread sexually. Now, why are we talking about all of this? We're talking about all of this because a lot of these STDs, people joke with them because they be like, it's just sex. No, a lot of these STDs, if they're not well treated, they can go to other sides of the body and cause things. Now, if you look at a slide on combination of herpes, this can go to the brain. It can cause brain damage. I give an example of that child. Herpes can damage the eyes, something called epic keratitis. I'll show you a picture. Another thing about syphilis, if you don't treat syphilis, syphilis can go to the brain, it can damage the brain. Syphilis can go to the heart, damage the heart. And chlamydia and gonorrhea, and this is for the ladies. Because of the way the reproductive tract of women looks like, if you don't treat chlamydia and gonorrhea, it can go high up and then it can damage the tubes of the woman. So, the woman where the eggs would go to and all of that. The person can have damages of that, and that can, affect the woman. A lot of cancers too can come with HIV, hepatitis B, hepatitis C, as I said earlier. Okay, now this picture here shows someone that has herpes in the eyes. We can see that. I don't know if you can see that. You can see that herpes in the eyes. Yes, and this is the baby that's actually. So this is what we call congenital syphilis. And what happens is the syphilis went from the mother to the child, obviously through the placenta, and that's one of the reasons why we do like to treat syphilis. Well, the next slide shows an infection. Well, that's called PID, what I mentioned about chlamydia and gonorrhea, which, like I said, is also very effective and we also should know about. Now, this is another thing I like to talk about. I'll leave it with medical, but one thing you should know is this person had gonorrhea. The gonorrhea went to the liver. So what you can see is the liver. You can see those things like gummy thing. It's from the infection by gonorrhea. Something in medicine we confuse hue cut it, but like I said, let's leave that for the medical people. But you just know that I just showed this diagram so you know that herpes, gonorrhea, chlamydia can actually go to other organs. Okay, the next slide is a PID, which I said earlier. So, if you look at that diagram, you can see that it's just saying that now on the right side is the normal, healthy female reproductive system. Now, the next side shows you can see the infection here goes up here, and kind of tracks, and then you can see something like looks like a pause. Now, this is what gonorrhea, chlamydia could do in women. Okay, now the next slide shows, well, someone that had some sort of abscess and they actually removed the person's womb. So that's how the womb looked like. They had to remove it because there was some sort of complications and all they had to remove it. Now, how do we prevent all of this? Number one, safe sex. Now we talk about safe sex. If you're going to have sex, have safe sex, because a lot of these things they are spread by unsafe sex. Screening. I usually will advise people if you're sexually active, especially if you have multiple partners, even though we don't advise for multiple partner, screening should be one of the things you should consider. Vaccination, very, very important. Some of these things have vaccine. I've mentioned this earlier. You should also get vaccinated. Abstinence, well, if you're not ready for sex, use protection. Very important to protect against things like syphilis, gonorrhea, and contact tracing. Now, this is important because a lot of times people would have, when they get infected, they don't want their partners to know, especially if they have multiple sexual partners. You need to, because if you don't treat your partner would go on to spread it and continue like that. It becomes a cycle. You understand? The next slide we talked about cervical cancer. Well, it's a big one, and because the world is talking about it, I'm not sure for months now. There's someone dedicated to cervical cancer because it's one of the leading killers in women. And I see said it earlier. HPV vaccine, people need to get their vaccine because it protects you, reduces your risk while you practice safe sex, tobacco, and all of that too, reducing risk of that because those things can increase the risk. And just to put figures there, yearly about 600,000 new cases are diagnosed, and in 2022, 350,000 women died of cervical cancer. That's a huge, huge number. And how do people? What are the risk factors for HPV? Now, HPV is one of the cancer. Cervical cancer is one of the biggest killers gynecologically in women. And some things that increases women's risk. HPV. You notice HPV keep coming out. HPV means human papillomavirus. Then smoking. Women that smoke, they have higher chances of having cervical cancer. HIV. Well, when early age at intercourse and when one has many sexual partners. Why is this? That increases their exposure to this virus. How does it present symptoms? Any faces, it doesn't show any sign. But later on, and all of these faces is already been getting late when the woman is having foul smelling discharge, and the cancers can also move from the woman's the main reproductive side and go to elsewhere. So somebody can have cervical cancer and start having chest pain. It can go to the bones, it can go to the brain. That is why we always talk about pap smear. Women should do all of this screening. So okay, that diagram it just shows what cervical cancer looks like. It's just like a cartoonish diagram that shows it. You can see something like an injury. You can see that like wound. That's the cancer. Now this is a picture of someone that they had to remove the wound, but you can see this thing. That's big thing there. That's a cancer. That thing that is circled. That looks like a cauliflower growth, which is really classic for cervical cancer. How do you prevent cervical cancer? Vaccination, pap smears, take to one partner is safer. Now shortly I'll just talk about prostate. I'm sure a lot of people are going to ask questions. So prostate cancer, just like cervical cancer, is a big one in women. Prostate cancer is a big one in men. I know earlier on I showed you what the prostate is like. So that small organ that is in men. If it can also get cancer, and that's why we always say, man, once you're eating your 40s, you should go for prostate cancer screening because every man, if you actually go to an old age, you have a higher risk of having prostate cancer, and your chances increase because one, you're a black man. If you're a smoker, it increases, and if you have a family history of that, it also increases. So every man has a risk of that, but your risk can increase based on some other things. Okay, just to show the diagram of the prostate again, you can see the prostate there. That thing is orange. It's sorry, I'm sure I don't think I have a cursor here, but I'm just trying to move it on my own laptop here. Okay, and just like I mentioned earlier, the risk factors being a black, smoking, obesity, your diet, and as you grow older, and that's why men, please, once you're touching, once you start passing 40s, you should think of PSAs and your cancer screening. And if you have a family, someone in your family has had it before, you should take this seriously. And well, like you say here, PSA screening starting at age 55. And if you have a first degree relative, extended member that had it, once you get in your 40s, please think about prostate cancer screening. And because of what the prostate is, when they have problems, the only thing is that the men will come and say they have difficulty urinating. Some of them will see blood in their urine, all of this, and difficulty urinating. So that's about prostate. So you can see that wellness actually also has to do understanding all of these things because many things of this can actually happen to people, and if people don't know. I mean, these are big killers. I'll just touch a bit on family planning because in Nigeria, a country where I feel we have some sort of population explosion, we need to talk about family planning because some people, could have unwanted pregnancy and they don't know how could I have protected myself. So family planning just has to do with various techniques that are used to limit or space pregnancy. So you can say I don't get pregnant, or okay, I want to get pregnant now. I don't want to get pregnant in the next 2 years and I get pregnant. So that's what family planning is. And there are various methods. So if it's commonly there are plenty. I put all of them there from pills to implants, injectables, vaginal ring, condoms. Yeah, condoms. And I just showed some diagram here. So this is just we can see there the female condom there. Can also see the male condom there, and also we can see the IUD. So that like device the woman puts it in a private part, and it prevents pregnancy. And yes, so another one we should talk to and this one is for my men, erectile dysfunction. Sometimes, you have this like, oh man, I cannot perform the others. My penis is not standing, or I am standing, but for 30 seconds then it drops. It's erectile dysfunction, popularly called ED. I think the world of social media call it. Is that what they call 2 minutes, man? I think, yeah, right. So I think there are a lot of names for that, and some of the risk factors, diabetes, hypertension. I actually tell people before me, when last did you check your blood pressure? When last did you check your sugar? Because a lot of these things can actually, affect a man's reproduction. And drugs, people that take a lot of drugs, there are some drugs that actually affect your erection. Yes, a lot of them. Hormonal problems, infections, when people have high level of smokers. If you smoke, smoking can distort your sexual life, and I usually will advise quit smoking if you smoke. So this is, I just put this diagram here. You can see how that's a flaccid penis, and how erection happens is when the man is sexually excited, you notice the blood fills the penis, and then the man's penis stands up, just like the diagram here. And one thing why this is important is that I do tell people, when you're having this problem, don't just go and look for herbs. I'm sure a lot of you that follow me know that these Harvard people are always not in agreement, because a lot of these things are dangerous. There's a lot of things we could do in the hospital. If you're having sexual problems, talk to your doctor. The thing is, that's just why they are the specialists in these cases. But don't just go for herbs and all of those things. And you should feel free to seek for help. I thought about premature ejaculation, which is another thing. And premature ejaculation, ejaculating before orgasm. So a lot of men will say, "Oh, doctor, once I'm 3 minutes in, I just not even 3 minutes, 30 seconds, I just the whole thing, 2 seconds, everything on bust." And a lot of things can cause it from anxiety, drugs, stress. Some people it's because they are being stressed at work or they're not happy with their partners, and even marital problems that put all of those days. Some infections also can increase hormones and chances. And well, ideally would say get good support, medical attention, and also I'll try to avoid prescription. Well, I know people have questions. I'll take them at the end. Infertility is a big issue, and is something that has scattered a lot of families. And I usually would say on social media, before you actually get to marry anybody, you should try and do fertility testing for man, SFA, look at your sperm. For the woman, just try and look at if everything's fine. Because a lot of times when people get married and they're having problems having children, it starts to, start, fight, and the family becomes messy. But if you pick up these things early, you get a lot of things. There's a lot of things that can cause infertility. And we should also stop victim blaming that it's from the woman, it's from the man. No, both parties can actually contribute to it. So it's always good to screen both parties. And here, I just listed a lot of the causes. So there are plenty. I won't bore you with that. Anything that can affect the man's sexual health, psychologically, genetics. So people are born with some problems. A lot of things can actually cause a man to have infertility. And some people that smoke also, if you notice, smoking keeps appearing. So everybody will agree with me that smoking is not a good one. And STDs, if you have STDs, make sure you get it treated, because you can see STDs is actually coming up again. Infertility too can happen in male and females. I mentioned some of those things I mentioned earlier. Those PID, which is a big one. Mentioned some things like fibroids, also some things called endometriosis. There's a lot of them. I put it in, in the slide. And a very big one is PCOS also, which I think is gaining awareness in the media space. And well, the next diagram here just shows the percentage of infertility. So a lot of times 30% of times infertility usually 30 more male and female contribute 30%, and mixed cause 20% in both of them. And sometimes if I really don't know, we might not even know why exactly is this person having infertility. So yes, it does happen. And actually, I would say there's a lot of things that can be done. You seek for medical help. We need to know why. Why is this person infertile? There's so much we can do. Also, carry your partners along. So that's the thing in a country like Africa, when people are infertile, they just want to, let me just hide it. You cannot. You should, because we get to screen, we get to do some testings, and we get to also treat. PCOS is a big one, and it's called, the meaning of PCOS is polycystic ovarian syndrome. Um, it has menstrual abnormality, and also, sorry, that is cyst in the ovaries. That's a mistake. And you also have excess, excess male hormone. So you have an imbalance in the female to male sexual hormones. And one of the risk factors is when one is on the big side, if you have a family history and also any condition that predisposes to having what we call insulin resistance. So I'm going to come to that shortly. Now, one of the things about PCOS is because what happens is that women, we have eggs in women, then the women have this cyst. Cysts are like swelling, circle in it. And because of that, the abnormality in the hormone, like human menstruation is controlled by the hormones. Now, because of these cysts, they start to have abnormalities in the hormone. They start to have missed periods. Some of them can bleed a lot. Some of them can have abnormalities. Some of them can have protracted periods of their cycle. And another thing is they have a high level of male sexual hormones. So it's not unusual to find someone that has PCOS can have excess hair growth, so they can have hair on their chest and all of that, and also they can gain weight. I'll show some pictures. Okay. Also, acne, some of the women can also go about, many of these things are actually caused by the hormones in the men. Sorry, in the hormones, the male sexual hormones in the men. They are meant to be higher in men. When the male sexual hormone is responsible for the men getting bowed. And like I said earlier, it also increases the chances of infertility. So some women can actually have some problems because they have PCOS. It can actually affect them getting pregnant, and they can also have something called it's called I can't just like you can show you. I'll show you a picture. You just see they have this thickening. Okay, let's just go to some pictures. Okay, this is a picture of what PCOS looks like. You can see that if you see the right side, you can see the ovaries is fine, there's nothing there. But if you look at this left over, can you see those circle things? I hope you can see them. So that's what PCOS looks like. Now, this is what I described earlier, acanthosis. So this is a lady that has acanthosis. You can see the thickening on all of the skin tags, darkening of the neck area and the armpit. So yeah. And well, this is one of the popular. She's an activist, and she has PCOS. One thing I mentioned that PCOS can have high amount of hair growth, what we call estrogen. If you look at her, you can see she's got a lot of beards. This is not very typical for women, but she has a lot of beards because of she has PCOS. And she's one of the popular activists who usually vocal about PCOS. The way that I thought to use that picture. There are so many things we can do. We should not discriminate. Oh, okay. Okay. So many things we can do, and we should not discriminate. And it's something that you need to work with a team. There are drugs available. There's so many things. We work with the nutritionist, the endocrinologist, gynecologist, clinical psychologist. So it's a team. And that's why I would tell people when you have some of these conditions, don't just say you want to go for herbs. Don't just. I will never be a proponent for herbs because there's a lot of things we can actually do as medical practitioners. Okay, endometriosis. I want to talk about endometriosis because it's also something I noticed at next slide that has been gaining ground amongst on social media. I think last month or 2 months ago there was a controversial post on endometriosis and people and they are trying to educate people with about endometriosis, and you can see basically what endometriosis is. Normally, the walls endometrium is the lining. So when a woman is when they are menstruating, is the walls of the endometrium that's usually coming out as blood. But people that have endometriosis, that thing that is meant to be in the womb, it now goes outside the womb. So you can see that you can see those black things. Next picture, please. Next slide. You can see those black. I don't know if you can see it. If you can zoom a bit, you can see that they're having this blackish. Now those things actually meant to be in the womb, but they're outside the womb. So when the woman starts menstruating, if those things are in the nose, she can start bleeding from her nose. If it's in the chest, she can start bleeding to the chest. So it's like she's menstruating outside the womb. So imagine someone having menstruated, yeah, menstruating, but the menstruation is not just in the womb. The person is also menstruating elsewhere because the walls of the womb are also present in other places, and it can be very painful. Well, vaginismus it just has to do with when the vagina, the next slide, and when the vagina is like not relaxing, and it could be painful for women during sex, and especially someone that's maybe anxious about sex, and it could also have primary, second, it could be primary or secondary also. Yes, this is one for my men, and if you follow me, you know I always talk about testicular examination. Just like we always talk about self-breast examination, men normalize examining your balls, touch yourself, and this is a DIY, do it yourself way of how you can examine your balls. I put it there. How you can do it monthly. You hold your testicle maybe after your bath, and hold it, examine it, rub it lightly, and also feel your spermatic cord. Feel, are there lumps in your balls? If you are shy of touching yourself, tell your wife or your girlfriend to do it for you. But men, we need to all learn self testicular examination. So as I come to a close of my presentation, so I take questions if there are. Do I have some FAQs here? I've spoken about STDs. We've spoken about STDs. The need to understand what STDs are, their impact, and how we can reduce our risk of having STDs. I also touched on infertility, polycystic ovarian syndrome, like cancers, HIV, and all of that. And I feel that well, if you can take some of these notes, I try to put compress and put all of this together so that we'll be able to get most of what I'm saying and make it simple. And so some people actually send some questions that I feel are interesting. I'll just answer. So there are FAQs that I have here. I'll just answer. So how big should my penis be? I think my penis is small. Well, I would just want to say that this is the side of the penis. But one thing I usually tell men, a lot of men don't have small penises, but it's because you look at your penis from up. Or if you look, so you get a better. If you don't want to know the side of your penis, go and look at the mirror. You see that you're carrying a big bula. That's what I usually would say. So yeah, so a lot of people might just because they've seen a lot of porn or something. Everyone has different sizes. It's not about the size. Do you know how to use what you have? Is foreplay important? Yes, very, very important in sex. You don't just go penetrating and rushing. Foreplay is actually important because foreplay kind of helps the woman's body get ready for sex and your body also, not only the woman. So foreplay is good. Breast and vaginal tightening cream, do they work? No, 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 they don't work. Don't let anybody collect your money free of charge. Those things don't work. They are all scams. So don't waste your money buying breast and vaginal tightening creams. Penis enlargement cream. Well, those ones they don't work. So anyone I sell penis enlargement cream, they're all just scams and things that you should not use. Okay, can I use Mokole Beta, Sapataya, Babajet to have sex? I'm sure before me know that's definitely a big no. You should not use all of those things. Many of those things contain illegal ingredients. Many of them are not safe for you. A consignment was seized last year by NAFDAC, and they actually found unsafe levels of sildenafil in it. So many of those contain sildenafil, tramadol, and all that drugs, and they are very dangerous. So please, if you're having problems with erection, just talk to your doctor. I think that's better. I cannot last more than 2 minutes. Talk to your doctor. What is pap smear? So pap smear is just the test we do just to screen for cervical cancer. I mentioned it earlier, especially for women. If you're sexually active, you should actually consider doing your pap smear. It's helps to pick lesions and many things can be done. Can I get an APV vaccine? Definitely yes. There's a lot of places, and I think currently the government is in partnership with I think MPHCDA. They are currently rolling out free vaccines for ladies age 9 to 14, if I'm correct. So if you have a daughter and she falls in that, please let them get the HPV vaccine. Does hymen equals virginity? No, 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 no. Hymen does not equal virginity. Yes, we know that when a woman is virgin having sex, the hymen is that membrane that caught. But some people can actually lose the hymen without having sex. If you're a woman that engages in things like bicycling, mountain biking, or athletic sports, they could actually lose their hymen. So hymen does not always equals virginity. And some people, even when you're having sex with them, the hymen can just bend and allow the penis to slide. So hymen is never indicated of virginity. Can we use porn to spice up our sex life? Well, as a medical practitioner, I would say you should not. If you think you're not performing well, apart from talking to your doctor, there are educative sex videos, not porn. But the dangers of porn is that porn sets unrealistic standard because a lot of those porn stars they are doing many of those things under the influence of hard drugs and all of that. And when you start watching such, you give yourself unrealistic expectations and feel you're not doing so much because you are not under drugs, but you're watching people take drugs. So please, and there's an emerging phenomenon where we're thinking called porn-induced erectile dysfunction. So we think that porn can actually increase the chance of men having erectile dysfunction. Like I said, it's emerging so much studies are still being done on that. So, in conclusion, reproductive health is an area that spans both males and females. And just like today, we talked about STDs, cancers, family planning, fertility. And one thing you should know is that help is available and should be embraced. So, I'm sure that some people will be very shy about this because a lot of times when um I talk about sex when I'm invited to talk about sex. People don't like to ask questions because everybody will say, "Ah, are you asking a question because you have this problem?" So, well, if you want to connect with me, I put my next slide there. I put my Twitter handle there. But because if you want to book consultation with me, it's not free. So don't message me and be saying, "Doctor, I heard you." Don't come and send me message for consultation. But if you want to connect with me, I mean, I put out a lot of health content there. You can connect with me on Twitter. My IG is there. Well, I don't really use IG, but I prefer Twitter. I prefer using Twitter. I don't really use IG. I also have a WhatsApp channel where I also post health content. You can also catch many of these there on Telegram. And I want to say a big thank you to the mobile classroom team for putting this together. It's a very good initiative, and I think more of this should be done. And thank you so much for bringing me. And thank you so much for the amazing listeners. And we'll be glad to take questions. Thank you very much.
Oh, thank you very much, sir. We do
Thank you.
appreciate you. So everyone in the house, do you have questions? Because you have the opportunity to ask him any question right now about the topic he just enlightened us about. So I've learned a lot of things right now that I have my questions written down right now, but I want others to ask questions. Somebody should open the floor of questions. Hello, can you hear me?
Yeah,
Do you
I
have
can
any
hear
Hello.
you.
questions?
Yeah, I have a question. Concerning the video that was viral, I think.
Okay.
Hello.
Yeah, I can hear you. Please go ahead, please. Hello,
Yeah,
you're
we had
audible.
we just noted white thing that was. Hello.
Hello. Yes, we can hear you.
Video that was viral, and you want to ask whether can that person be cured?
Okay. Okay, nice question.
Since
So sorry, I think your network is breaking. I'm having difficulty hearing you. So did anybody hear the question? I'm trying to listen, but I really cannot
Yes.
hear.
He asked that the viral video that you talked about, can it be
Yeah.
cured?
hello, can you?
Okay.
Yes.
Okay. Okay. Well, HP that does not have a cure, but it can actually get treatment. There's a lot of things. I saw a lot of comments around the video that the penis is gone. No, there's a lot of things that could be done for those lesions. So yes, treatment is available. Yes, treatment is available. Hello, were you? Hello. I don't know if this person heard me.
Yeah, Mr. Musa,
Hello.
can you hear?
Okay. Yes. So I was saying concerning the viral
Yes, I
video
can hear.
because what the okay, I was saying what the person had was what, and like I mentioned, what is caused by human papilloma virus. Now, what itself has no cure, but many of those lesions that the person has can be taken care of. You understand? So
Yes.
a lot of these viral infections, the body actually clears them. But I'm sure a lot of people were more worried about those bump things on the penis. Yes, they can be taken care of. from special creams that are designed for it, even to laser therapy, cold therapy, cryotherapy. A lot of things can be done. So many things can be done.
Okay, thank you, sir.
Yeah. But the virus itself does not have a cure.
Thank you.
You're welcome.
Okay. Do you have more questions, everyone? We're waiting for more questions. You can ask more questions if you want now.
So, good evening, doctor.
Hi, good evening.
Yeah, thank you very much for the insightful class. Please, quickly,
You're
I just want to
welcome.
ask. There was a time you talked about digital rectal exam, that's DRE. So you mentioned that men needs to do this exam, and it is very, very confusing to me because why should men do this? Because the process. I'm sure you know what I mean. So it's actually
Okay.
very kind of very hard. So I want to know why you think men should actually do this, or because I really need to know, please. I don't know if you can shed more light to this.
Okay. So earlier on, I mentioned sorry, earlier on, I mentioned talk about DRE, prostate. Now, I just want to go back. Okay, can we go to the slide? I think I will answer your question, but I want us to go to the slide so you see the picture. So admin, can we go to slide number? Just a minute, please. I need to use that picture to show what I mean. Um, okay, sorry, slide number. Uh, oh, okay. Slide number where I said the male reproductive system. Just a minute. Um, okay, slide number 4. Yeah, number 4. Number 4. Okay, good. Now I don't know if you can see that diagram well, but you can see that orange part. Well, okay, maybe can if you can zoom a bit. Yeah, you can see that orange part. Yes, that orange part. That is the prostate. Okay, can you use the cursor? Yes, that's the prostate. Now you can see that the anus is just at the back of. You can see the anus is just at the back. Now what happens is that when they are examined, when the man does the abdominal examination, that's the only way we can get to touch the prostate. You understand? There's no other way you can get to the prostate. And just like a lot of people will say, "Oh, is it painful?" It's not painful because one is that to be explained to you, we also would use some lubricants that will make you relax. But that's the only way we can use our hand to touch the prostate. And why is it important? When we do an abdominal examination for men, it's one of the things we want to do, the digital rectal examination, to have a look, you understand, at the inner region of the man. And that's the way we have to stick our finger inside. And that's why it's called digital rectal examination. And it's one of the things we do, because some people will say, oh, and from there we can actually see if there's a problem with the prostate. If the prostate is big, from touching it, if the prostate is hard, like people that have prostate cancer now, the prostate can be hard, like it can look stony. You understand? You're able to feel, even though it's not confirmation, you're still going to do tests. But when your doctor examines you, the digital rectal examination also comes handy, and it's something that as your doctor examines you one of these days, you probably would then get wrong. So I know a lot of people be like, oh, it's somehow like putting a hand in my anus, but it's not really like that. There's a position you're going to assume, which your doctor is going to tell you about. There's also kind of lubricant that is used, which will make it relax, and trust me, it's not painful. I've gotten one done before. Yeah. I hope I was able to answer your question. Okay, do we still have more questions?
Okay. let's okay. While I wait to ask my question, we can wait for other people to ask a question. So I want to ask a question about
Go
the
ahead, please.
HPV, the vaccine.
Okay.
Is it very important for us to take as a woman?
Yes, it's even more important in women. And why is more important in women? Because of, like I mentioned, cervical cancer. So in women, I'll say it's a must. You understand? It's very much because the next question will be like, where can we get it? It's very much available in government hospitals. If you walk in there, once you get your pap smear, you get. But every woman that's made a sexual debut should actually get vaccination. You should actually take it before making the sexual debut. But just I'm saying it's actually good because why? A lot of men too can actually carry HPV in their penis. Like that video that went viral. That's what the man must have neglected his health and understand, or maybe it's immune suppressed. Men also can carry the virus on their penis, so you can have sex with a man, and then you will know the man will give you the because you're not vaccinated. So everyone should actually get it.
Okay. And it doesn't have any side effect at all.
No, it doesn't have side effect. It's more it's protective.
Okay. 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 Do you have more questions in the house? Hello, everyone. No question. This because this is a very impactful session. I believe everyone should have one or two questions to ask. I guess we all know everything that you said now. What Dr. Kino has said before. I'm sure we have one or two questions. Please ask.
Like I said, that's one thing about secure webinars. People would rather send it as text. People
Okay.
always try to ask questions.
Wow.
So I can totally understand. But
So
I'm
I also want to ask another question, Doctor.
please go ahead.
Um, when we talk about woman's sexual ability, when is it good to accept fingering when having sex?
Is it good to what? Accept fingering?
Yeah, as a woman.
Oh yes. Being fingered, it's not. There's no hard and fast rule about it. But it's just that well, if anyone is going to finger anyone, it should be hygienic. The person's nails at least should be clean. The person should not also traumatize the vaginal wall. Or if you are okay with fingering and your partner is knows how to finger you, I mean, just are things you could add to your foreplay. It's not a bad idea.
Okay. Okay. Thank you very much.
You're
So
welcome.
I'm not sure anybody wants to ask any question right now. Is anyone do anyone want to ask any question? I'm not sure. So thank you very much for this impactful webinar, for this impactful subject and topics. I really appreciate you. And we thank all our participants too for joining and for listening to this webinar. This our platform here, we have a lot of other sessions webinar that can come up here. So can of any different of every different areas. We are for health, we are for safety, we are for different sessions. So you can join us here, and you can also use our live meet to host any webinar or any coaching or any event. So it's free. We don't charge you anything to host anything here online. So we'll be expecting you to come here often, and you'll be seeing more webinar sharing events that we host here. Thank you very much for attending this. Thank you, Dr. Shina, for hosting, being our guest speaker.
That's
This topic
fine.
is very impactful. I learned a lot, and I'm sure a lot of people to pick one or two things that they have learned here today. Thank you so much. Really appreciate you. Thank you.
Bye.
Bye.
Thank you, everyone.
Bye. All right.